afternoon, sir. I'm Rochelle and I'm your nurse for today. So for today, we're going to do the assessing your temperature. So before doing the procedure, I already sanitize and perform hand washing to prevent the infection while doing the procedure. And we need always to have the our gloves when doing the rectal procedure. So, aside from that,
I also provided the client's privacy to prevent the exposure of his body part.
so let me start. So first, we're going to position the client in seams position or the seams lateral position when doing the rectal temperature. So, sir, we're going to... So next, we're going to place the thermometer inside the rectal part of our patient. Next is after inserting the thermometer inside the rectal part of our patient, we need to wait approximate time to the temperature of the patient. So after the temperature of the collecting the temperature of the patient, we need to remove the thermometer of the oven of the rectal part. After collecting the temperature of the patient in the rectal part, the body temperature in the rectal part of the patient is normal. After collecting the temperature of the patient, we need to clean the thermometer or probably disposing it. After disposing and performing again the hand hygiene or hand washing, we need to document the client's temperature or record for the client's chart. Good afternoon, sir. I'm Rochelle and I'm your nurse for today. So for today, we're going to do the assessing the radial pulse. So before doing the procedure, I already sanitize and perform hand washing to prevent the infections of the clients while doing the procedure.
I also provided the client's privacy to prevent the exposure of his body part.
So let me start. So first, we're going to select the pulse of the patient. The radial pulse of the patient, which is this. Next is we're going to assess the pulse point of our patient, which is the radial pulse. After assessing and documenting the radial pulse point, we need to assess the comfortable resting position of our clients, which is the sitting position. After this sitting position, we need to palpate and count the pulse of our clients. After documenting the client's rhythm, volume, and the palpation, we need to document it in the client's chart for documentation of the clients. So after the radial pulse, I am going to do the apical pulse. So first, we're going to position our clients in the supine position because it is comfortable for him. So after that, we need to locate the apical pulse of our clients, which is this part. After locating, we need a stethoscope to to documenting her heart. We need to auscultate the apical part of the patient for 1 full minute. After auscultating the heartbeat of the patient, we need to document the pulse of the patient, which is the 60 beats per minute, which is normal for the patients. And lastly, we need to record the patient documentations and records for the client's chart. Good afternoon, sir. I'm Rochelle and I'm your nurse for today. So for today, we're going to do the assessing your blood pressure. So before doing the procedure, I already sanitize and perform hand washing to prevent the infection while doing the procedure. So, and aside for that,
I also provided the client's privacy to prevent the undue exposure of its body parts.
so let me start. So first, we have a stethoscope and sphygmomanometer for taking the blood pressure.
Next is we're going to assist the client's comfortable position, which is the sitting position with the forearm supported at the heart level and with palm facing upward. Next is we need to expose the upper arm of the patient.
So the blood pressure of the patient is 103/61, which is normal to our patients. After taking the blood pressure, we need to clean the earpiece of our stethoscope. After that, we need to document and record the patient blood pressure for the client's chart. Good afternoon, sir. I'm Rochelle and I'm your nurse for today. So for today, we're going to do assessing your respiration. So before doing the procedure, I already sanitize and perform hand washing to prevent the infection while doing the procedure.
And also, I provided the client's privacy to prevent the undue exposure of its body parts.
So, let me start. So, first we're going to have the position of our clients, which is the sitting position. Next is we need our watch to document the respiration within the 1 full minute. The patient respiration is normal within 12 to 20 beats per minute, which is normal to our patients. After documenting the respiration of our clients, we need to document and record it for their clients' records.